Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide another quick answer to important questions. This question is, if we're all going to get COVID-19 anyway, why don't we just go about our normal lives and get it and move on? And why do some people think this? Well, for two reasons. One, they've been told that herd immunity is a way to protect people from infectious diseases, and that herd immunity can either be achieved by vaccination or widespread natural infection. And both of these are true. It is true that herd immunity is often the best way to protect a population from infectious diseases, and it can be achieved either by widespread natural infection or widespread vaccination. Well, if both of those are true, does it mean that we should just go about our normal lives? So let's think about what it would take to get herd immunity without a vaccine. According to experts, about 70% of the population would have to be immune in order to protect us from COVID-19. In the United States, that would mean about 220 million cases of COVID-19. If the death rate is 0.6%, currently used by the CDC, that translates into over 1 million deaths, more than 5 times more deaths than we've already had. But of course, that's only the tip of the iceberg, because many more people would be hospitalized, would be sick, and develop chronic, in some cases, long-standing issues with heart and lung problems. We're not even sure yet that infection with SARS-CoV-2 causes long-term natural infection. There have been reports of people becoming reinfected both in the United States and in other countries. That calls into question whether or not it would be possible to develop herd immunity. Additionally, if the virus mutates, as the flu does, natural immunity would have to be reacquired every year. And then the question is, would it even be possible to protect the elderly, as some have suggested, if everyone else that they're exposed to has not been protected? So if we gamble on developing herd immunity from natural disease, the consequence would likely be significantly increased number of deaths, especially in the elderly and those with chronic disease, perhaps 5 times as many deaths as we've already seen, as well as a tremendous burden on our healthcare system and unknown long-term consequences for those who've been infected. And I don't think that's a gamble we should take. If you have any questions or comments, please let me know. I look forward to hearing from you. Thank you very much.